Okay. All right. Welcome, everybody, to another Holistic Health Hour. Let me get to the chat, connect the chat. Hopefully, that's going to work this time. I know I missed a lot of your chat questions before. I'm Dr. Kevin Connors. Apologize for my gravelly voice and tired eyes. We were on a couple days vacation and our flight got delayed. So we didn't get in until really late last night and then had to plow on our driveway. So, enough of that. Let's jump to our questions. A lot of you have sent questions in on the Holistic Health Hour page. There's a spot on the bottom where you can ask your questions. So make sure you do that and you can chat them in. Hopefully, I'll get the chat. But we have a whole bunch, so we better go in. Hi, all. I have had some blood results come back from a finger prick test as my doctor refused to allow me to have any tests done. So I've had my results and they have shown to be slightly low on B12. So I think this person is saying their doctor refused to order labs for her, so she ordered some different blood spot labs, which you could do. Anybody could order blood spot labs. You do a finger prick blood spot test and you can get different labs done. You can do it from home without a going in and getting a draw. However, how do I know what the healthy amount should be? I assume of B12. Do I go along with the NHS sites saying low, high, normal, or I just don't trust what is given to me by the general practitioners? Good question. I actually have a video on this that talks about lab value normals. So there's in short, so I recommend get to our site to watch that video. It's on our blog post. If you look up blood tests on our blog post, it'll probably come up on that. But there are different labs will have different normal lab ranges. So there's lab value normal and abnormal lab ranges, and then there's what's called functional lab value ranges. For vitamin B12, I think most lab value ranges is between 35 and probably 165 or something like that. I know the functional range is like 65 to 165. You almost never have to worry about elevated B12 levels. If a person is taking B12, most of the time they will show elevated B12 levels when you do a blood test. You can just pretty much ignore that. That can be a sign that B12 isn't getting in the cell. But really what you're concerned about is low B12. So there's a couple reasons why you'll have low B12. So if it's on the lab value is down near the low range, you could pretty much assume that it's functionally low. And a person would have functionally low B12 for a number of different reasons. They can have intrinsic factor issues genetically. They don't make enough intrinsic factor. Intrinsic factor is made by the parietal cells in the stomach, and that's what you need to absorb B12. You could have absorption issues for other reasons, gut issues, gut inflammation. Hypochlorhydria is a very common, maybe the most common reason for low B12. If you have a decreased stomach acid production, you're going to have a decrease in intrinsic factor secretion, so you're going to have low B12. There's also genetic factors. If you have defects on your MTR gene and your MTRR gene, you're going to be more prone to having issues in absorbing B12 too. B12 anemia is quite common. And most people don't have an issue taking B12. The only thing that I would caution you about if you take B12 is to take a sublingual lozenge would be better. It's better to get some absorption in your mouth if it's an intrinsic factor issue. So if you take a lozenge B12 that you suck on and you let it absorb in your mouth, you're going to get some absorption through your buccal mucosa. And that will kind of bypass the issue that you may be having with intrinsic factor and other absorption issues. So take it that way. Second caution is most of the B12 on the market is methylcobalamin. And if you I know that's the big hype that you should be taking methylcobalamin and methyl tetrahydrofolate, because if you have MTHFR defects, everybody should be on that. Problem is that's just not true. You got to look at the whole picture. If a person has MTHFR defects or MTR and MTRR defects, still you don't necessarily want to supplement with methyl groups, either methylfolate or methylcobalamin. You want to look at the other genetic pathways, your biopterin pathway, your serotonin production pathways. And if you use methylcobalamin or methylfolate into higher concentration, it can push that pathway, and you could end up with excess serotonin levels, and imbalance in serotonin levels can cause anger, rage issues, and all sorts of different problems. So I would suggest, to be safe, a hydroxycobalamin or an adenosylcobalamin. Stay away from the cyanocobalamin. So hydroxycobalamin or adenosylcobalamin in a lozenge. That would be the best way to support that. Always, though, when you have an abnormal blood test, always, you want to find out why. You want to ask why. You don't just use supplements like a medical doctor would use medicine without asking that question why. Go back to, okay, if I do have low B12, what else is going on? Did you get an adequate complete CBC and metabolic panel and other things too, to see if there's other things going on. There's patterns for hydrochlorhydria that I mentioned as one of the causes of low B12. I have a video on that too. So go to the blog and search HCl. Just search that, and you'll see a video that I created on hypo. I created several blog posts on low HCl production in your stomach. So look at that as well to make sure that you're doing proper investigation instead of just putting a Band-Aid on something. Find a functional doctor that can help you with that if you need more help too. Okay. So sometimes the questions, I don't fully understand the question, but let's read through this. Carpal tunnel, tendonitis, rheumatoid arthritis, osteoarthritis, arthritis. Is there a permanent solution? I've been taking and making herbal tinctures, teas, soaking in mustard baths, magnesium oil, using castor oil compresses. Just started so far, have felt better. So when a person mentions multiple different syndromes, carpal tunnel, tendonitis, rheumatoid arthritis, osteoarthritis, arthritis, all those are different things and can have different etiologies. So they're all inflammatory. So maybe the common, disorder is increased inflammation, and you really need to get down the inflammation, or better yet, find out why you have an increased systemic inflammation. But if it's mainly arthritides, with joint issues, obviously most of these are joint issues. Carpal tunnel is a joint, but is more so a tendon issue and a muscular issue with the brachioradialis muscle on your forearm. So carpal tunnel patients have issues with their forearm. Lots of times they have spasms or swelling in the brachioradialis, either due to excess use. Common thing is using your mouse all day on a computer. You can get carpal tunnel issues, or typing all day, you're going to get carpal tunnel issues because you're using those extensor muscles of your forearm. So working those out, stripping those out, working on origin insertion points on those muscles can be very helpful. If you find it, you can go to a physical therapist or a chiropractor that does kinesiology, applied kinesiology. They can best help you with carpal tunnel. Tendonitis depends on what tendon is involved. Tendonitis is inflammation of a tendon. It's usually due to an injury. So if there's an injury, that tendon can be, partially pulled away from the bone and pushing it back on the bone physically. It's, again, doing physical origin insertion work can be extremely helpful. Again, find a chiropractor, naturopath, or physical therapist who does applied kinesiology. Rheumatoid arthritis is completely different than osteoarthritis. So osteoarthritis is a degenerative arthritis. So if I hurt my knee playing football in college, and now I'm 45 years old and I'm starting to have a lot of knee pain at that spot, It's because of wear and tear. It's because of abnormal biodynamics, biophysics of that joint, because of an old injury. So osteoarthritis is the same thing as degenerative joint disease, degenerative disc disease in the spine. That is degenerative arthritis. It's not inflammatory based. It might have inflammatory components. Maybe there's inflammation at the injury, but it's not caused from inflammation. It's caused from degeneration. Rheumatoid arthritis, psoriatic arthritis, those are autoimmune conditions. So if a person does have a diagnosis of rheumatoid arthritis and they have elevated RA factor, that's a totally different ballgame. So that's not a degenerative disease. That's not caused from ill use of your hands or something over time. Just because you may have been in a profession where you used your hands and overused your hands, that will not cause you that will not be a precursor to an autoimmune type arthritis. So the arthritides that are autoimmune based, totally different ball of wax. You really need to jump on our chronic disease and autoimmune course and start learning about how to deal with autoimmune disease, because you have antibodies against those joint capsules. It's destroyed that joint. You're going to have, there's 3 different phases of autoimmune disease. You need to learn about that. There's a lot of things you need to figure out what the triggers are and such, to help calm that down. So the question was, is there a permanent solution? Well, it really depends on what we're talking about. Usually with carpal tunnel and a tendonitis, yes, there's a permanent solution. You could heal that. With the degenerative arthritis, not so much a permanent solution. It's about management. It's about increasing the joint fluid in the joint capsule. There's a lot of different management techniques for degenerative arthritis. With an autoimmune condition, with an autoimmune arthritis, it's not a cure either. It's management, but it's a totally different form of management with an autoimmune disease. So get on our chronic disease and autoimmune course. That's exactly why I created that course, so you can understand what an autoimmune disease is, how to deal with it, and how to deal with the triggers that could go along with autoimmune disease. Okay, next question. This one's a really long one, so I'm not going to even read it all. I need help with mind-numbing pain from cervical and lumbar spine, degenerated, herniated compression discs with bone spurs, ankylosing spondylitis, rheumatoid osteoarthritis. This might have been the same person that asked that other question. So, there's just no way that I can give more of a detailed answer for somebody with a very complex and multiple different comorbid issues. So you really need to, I apologize, but some things, this is not really the format to be able to help somebody with a complex issue like that. So feel free to go on our website. You could start off with a case review with me. Maybe that would be the best way to go, and we could kind of break some of these things down and work through some of these things. Question came in on Facebook. What is a good herbal for dysmenorrhea? I encounter a week of pain every month, whether I have menstruation or not. There are a lot of different herbals and adaptogens that can help balance hormones. However, you could just, there are a lot of different products on the market that you could just trial and error. That's what most people do. However, I think it's best to test and find out why. So getting a Dutch test done would be, I think, the first thing to do. So if you were a member of ours, that's what I would push you for, to get a Dutch test done to measure it. I know I hound on that every week, but we can't. I understand that testing costs money, and people are hesitant to spend money to find out what's going on if their insurance doesn't pay for it. And I understand that struggle. But I also understand that if we're just throwing darts at a dartboard, we may hit it, we may not. There's a lot of different herbals on the market for balancing hormones. If you're going to go that route, I would start with some adaptogens to see if you can balance your hormones that way. But the best way to do this is to know what you're doing. So you only know what you're doing is if you run some labs. So getting a Dutch Plus done or a Dutch Complete done, and you can get that through our courses on our website. You can order that and measure your hormones. So you're measuring your estrogen, your progesterone, your androgens, and all the and the cortisols. So to really get a measurement is going to be the best way to go. I'm sorry, I don't have like just take this and it's going to solve it. And quite honestly, you guys, I'd be leery of somebody that says that. At least that says that a lot. Now there are some things that you could say that for. I have digestive issues and I know I have decreased HCl. What should I do? Well, you should take HCl, right? You take some digestive enzymes. When you talk about we don't really know what's going on, it's better to test. I mean, a person could have dysmenorrhea and they have fibroids, so how do you know that unless you do some tests and you look at some lab levels? Also good to get a CBC. Make sure you don't have anemia issues going on. That would point to something like that's more serious, like a fibroid or a ovarian cyst or something like that. You want to make sure that, I mean, you want your doctor to be thorough, right? You don't want me to give you answers that aren't thorough either. So that's what I would do, is to always measure if you could possibly do that. Next question, what do you recommend for immune support for kids who are prone to allergies, ear infections, and sinus infections? So depending on the age of the child, testing can be done as well. Again, I'm going to sound like a broken record, but okay, let's say my 2-year-old gets ear infections and allergies on a regular basis, and I'm running to the pediatrician and they're giving him antibiotics. First of all, 99.9% of ear infections are not bacterial based. So taking an antibiotic is just doing more harm than good. You're just damaging the gut and the flora throughout the whole body. Just highly don't recommend that. Unless you did a blood test and you had elevated white blood cells and elevated neutrophils and suppressed lymphocytes, then you'd say, okay, this person has an infection and doing an antibiotic is the right course of care. But if they just looked in the ear and say, oh, you have an ear infection, here's the antibiotics, that's just malpractice. That's just wrong. So don't do that. There's reasons why. So I always dig into the reason why, right? So if a child has regular ear infections, you start thinking of what your comment was on this question. Does this child have allergies? Most common thing for regular ear infections, regular sinus infections, are food-based, not environmental-based. Unless the child, getting a good history is important, right? So, I only get these in the spring when pollen is flying. Then I get ear infections, I get allergies and sinus infections. Well, it's probably then environmental-based and something like pollen or something. But if no, this happens throughout the winter when there's no pollen in the air, then it's probably food-based or chemical-based. So a sensitivity to most common, what would it be? Gluten and dairy, most common, right off the bat. So if they have a gluten or dairy sensitivity, that means if they have antibodies to gliadin and any of the gliadin peptides, or they have antibodies to casein, you're just going to be, they're eating that stuff, you're just causing inflammation. Casein especially is going to be very mucus forming, and there's the problem, most likely. You can also have antibodies to chemicals in the environment. The most common would be food-based, but definitely chemicals in the environment, from fluoride to mercury to a whole bunch of different things, could be things that set it off as well. So many times a person has antibodies to foods that's causing the issue, and then they just get tipped over by pollen or something like that. So really, pollen isn't the primary thing. That's just what tips them over. So they're already so near the threshold of a hyperinflammatory response, and then spilling out, you know, the increased mucus formation, and then they end up with other symptoms. So what do you do for that? You have to investigate. You have to find out what is the thing that is causing the inflammatory response. So putting on your Sherlock Holmes hat if the kids are too little to do a blood test, and just start doing some food elimination diet. So again, most common would be dairy and gluten. Um, could be followed by dyes and additives, colorings, glyphosates, chemicals in the food. That's going to be your most common thing, is food-based, food sources. So clean up the diet, go organic as much as possible. Um, kids that have this, even if they cut way down on dairy and gluten, they would have, a decrease in their symptoms. So look at that. Next question, I don't know if it's from the same person or not. Had an ear infection in a 4-month-old, was given a medication, is now having diarrhea and rash. So again, an ear infection in a little child, such a slim chance that it's bacterial. For them to give you an antibacterial drug, it's just going to cause gut issues. So, and now they have diarrhea and a rash. So you have to make sure that if you're breastfeeding this 4-month-old child, that you're getting good probiotics, you're having a good diet with as many different types of food as you possibly can. A variety diet is super important for your gut health and your flora health. You're not going to just build your flora by taking a probiotic. It's a variety of foods in your diet is really, really important. That's going to pass through the breast milk. Hopefully you're breastfeeding, and that's going to help your child. I would not give a child an antibiotic unless I knew that they had a bacterial infection. I'm not against using antibiotics. It's just responsible use of antibiotics. You don't use an antibiotic unless you know that you have a bacterial infection. There could be other environmental things for these things too. One thing is mold in the household. We run a mycotox test, which is a urine test on a lot of our members, and it's amazing how many people come out positive with that. There's mold in their house. There's mold exposure that they've been exposed to at some point in their life. A mycotox test isn't testing for active mold in the person's body. It's testing for toxins that the mold produces. So if you have mycotoxins, those are poisons that are produced by different molds. So you're either getting them in your food, you're either getting them in a moldy building syndrome type thing, or you're exposed to them in your past house that you lived in, or your past workplace, or church, or something like that. You got to deal with it because these things are poisons and they're bad. Next question: do you have any additional information about calcium supplementation? I don't know about additional information you're talking about, because I'm not a super big fan of calcium supplementation unless the person is diagnosed with metastasis to the bone and or are diagnosed with a decreased calcium, bone formation. And then even with that, you still want to use MK4, not MK7, with the calcium. We have a product at our store. Oh, what's it called? Let me look it up. It's the only one that I recommend now. Osteo-K, that's the name of it. It is, it's got vitamin D, it's got calcium, only 200 milligrams in 2 capsules. And you think, wow, that's not very high. That's right. You don't want to ever take high-dose calcium. So if you take high-dose calcium, it's going to be deposited in your arteries. And that's going to cause atherosclerosis. You do not want to ever take high-dose calcium. And it's really the vitamin K2 as the MK4 form that is going to be the most important to help get calcium into the bones. Otherwise, it's just going to be deposited in the arteries and you're going to end up with heart issues. So don't ever let any practitioner convince you that you need to take high dose calcium. That is just not the right thing to be taking. So I should do I don't think I have a blog post about this. I will have to make one. I'll make a video about it. Next question. I have had blood results come back that I'm now low. Oops, I did answer that one before. How to increase progesterone production in women with normal LH, that's luteinizing hormone, FSH, follicle stimulating hormone, and E3G levels currently at a healthy weight, and take Chasteberry and Earthly's Nourish Her Naturally and Earthly's Fertile Boost. Okay, so I don't sell those products, so I would literally have to Google them and see what's in them. So if you're trying to increase progesterone production, um, my question would be why in the first place? What are you trying to do? Did you measure it? So if the person answered yes, I measured it, I did a hormone profile, and my progesterone is low. And I read I have, all these symptoms of low progesterone, or I'm trying to get pregnant. That can be an issue. A person can have a difficulty getting pregnant because they have low progesterone, or they've lost babies and they're trying to be able to hold a pregnancy. It can be because of low progesterone. It's fairly easy if you know those things and you're trying to then boost progesterone levels up. It's fairly easy to do so because there's a lot of topical progesterone on the market. So I don't know those products that you just mentioned in the question, whether they have progesterone in them. If they're oral products, I mean, you're taking a pill or they're a powder or something like that, then that probably doesn't have the progesterone. So the progesterone that you could buy on the market is a serum or a cream, and you put it on your belly or your thigh, and you absorb that, and it works wonders to boost your progesterone. So that's the easiest thing to raise, really, from a hormonal standpoint, is progesterone. You can, like, I don't want to take hormones, I don't want to take any progesterone. You can just stimulate through adaptogens, and I would assume that that's what these products that you mentioned are some adaptogens. So taking those, if you haven't started those or you just started taking them, and then measure your progesterone again, that would be the thing to do. If it's still low, then you could probably go with the serum topical. Next question. My white blood cell count is very low. I have leukopenia. How can I increase my white blood cell count? Help. Again, you want to find out why. So why does a person have low white blood cell count? So if the person has low white blood cell count because they have cancer, they have a diagnosis of cancer, they've been dealing with cancer, and maybe they went through chemotherapy, and then they have chronic low white blood cell count because of that. That is a common thing that we deal with here. You can also have low white blood cell count because of chronic infection. So somebody has like a chronic Epstein-Barr, especially a chronic viral infection, can just drain their white blood cell count. So that could be a cause of white blood cell count, but you do want to find out why. So, and then boosting your white blood cell count is not very easy. So you could do things to help support white blood cell production. Medicinal mushrooms can be beneficial. There's, again, it's so, I hate to get too technical here because it depends on what you got going on. If you have an autoimmune disease, then you have to be careful of taking a bunch of immune stimulants. So a person with a chronic autoimmune disease can also have suppressed white blood cell count. And then if you're going to take immune stimulators like vitamin C and things like that that are going to be natural stimulators like herbal echinacea and astragalus and things like that that you think of if you take if you had an infection or a viral infection or a bacterial infection, it can make you worse. So you do want to discern um, and get a differential diagnosis of whether you have an autoimmune disease as well. If you know that you have an autoimmune disease, then I would stay with the medicinal mushrooms and the vitamin D. I would get your vitamin D level checked as well. Many times, the low white blood cell count, a person could have a vitamin D level of about 30. That's very low in my book. You want to get it, up at least twice that much. Getting your vitamin D elevated can be helpful. Using medicinal mushrooms can be helpful. And the reason why I say sticking to those two if you have an autoimmune disease is because those are immune regulators. They're not immune stimulators. So they will help. They will help bring up your white blood cell count if it's low, and they won't bring it up excessively if it's already high. Versus immune stimulators like different herbals, like I mentioned, astragalus and echinacea, and even vitamin C and even zinc, and taking something that you would take thinking that you have a bad cold or you're coming down with something that is an immune stimulator um, is not a good thing to take if you have an autoimmune disease because you're going to increase the attack on cell tissue. So it really sometimes it's hard answering these questions because I don't know the background. So everybody's a little bit different, and you it's not a simple answer. Next question. Hello, how are you doing? Thank you. I would like to know more about how the pancreatitis cancer is treated. So, pancreatic cancer is treated. I would like a lot more about vitamins and how to use that with other medications. Okay, so pancreatic cancer um, is just a one form of cancer. How is it treated from a oncological standpoint? They're definitely going to use pretty heavy dose chemotherapy with that. And there's a certain type of surgery that they do with pancreatic cancer if you're a candidate for that. Depends on what it looks like on the CT and MRI. Um, from a natural standpoint, pancreatic cancer is treated um, differently depending on who you go to. So if you use, there's lots of different natural approaches to cancer. So in my book, I talk about making sure you get tested for how to treat it. There's lots of different natural cancer treatments that can be extremely beneficial, but not for everybody. And what are you going to choose to do? You search cancer treatment, alternative cancer treatment, and you can get bombarded with information that may not apply to you. So we do cheek swab testing in our office. That makes us quite unique. So we get specific in our protocols. But just to be honest, everybody's different. We've helped people with pancreatic cancer that are, every single person is on a completely different protocol. If you go to our Stop Fighting Cancer course, it does give you some ideas of different protocols, things to start with. One of the common protocols with pancreatic cancer would be using enzyme therapy. So you're using fairly high dose enzymes, pancreatic enzymes that you take on an empty stomach to help break down the slime layer around a growing cancer so that your immune system can get at it. But you also have to couple that with immune stimulation therapy. We use Rife therapy, I highly recommend that for everybody that's doing that has any type of cancer diagnosis. The beautiful thing about the Rife is that I believe that it really helps if you're doing chemotherapy. It helps the chemotherapy target the cancer better, so you're going to have, I think, better results. I think years down the road, if here and the Lord doesn't tarry, that I think the Rife will be used by oncologists to help chemotherapy target cancers. But as far as you said, I'd like a lot more, like to maybe learn a lot more about vitamins and how to use them with other medications. Um, so there are some interactions if you're going to go and you know using chemotherapy. You don't if you're going to use chemotherapy, you don't want to use oxidative antioxidants as far as supplements go. So your oncologist would state that to you, I hope. So you make sure you tell your oncologist if you're doing a bunch of supplements that you decided to pick out. If you're going to do chemotherapy, you don't want to take antioxidants at least for 48 hours after you do the chemotherapy, because chemotherapy is a oxidative um, uh, agent. Next question: is there anything holistically that can be done or used for a schwannoma? So a schwannoma is a tumor around a nerve. So the nerves in the periphery, not in the brain, but in the periphery, um, have myelin sheath cells. And the myelin sheath is made by Schwann cells in the nerves in the periphery. And a schwannoma is a tumor. It could be anywhere. So, but it's anywhere on uh, the Schwann cells. Um, so, what can you do holistically for a schwannoma? Well, what can you do holistically for a tumor? So again, Rife would be my first choice. I would start using Rife therapy um, to help your body attack that and break that down. So a schwannoma is a tumor that's typically not going to be, you know, anything that's going to, be deadly or anything, but it can be very uncomfortable and cause all sorts of issues. So I would use Rife technology. PEMF can be helpful too. Anything that's anti-inflammatory can be helpful. So the flavonoids can be helpful with that. So those are things like curcumin, resveratrol, green tea extract, um, things like that can be very helpful with that. Schwannomas can be formed post-injury. So when you dig to causes of schwannomas, usually it's like, something on your foot that you damaged or something like that. So it can be post injury, post stress, um, uh, typical causes of schwannoma. So anti-inflammatories, Rife technology, even using electrical frequencies like the TENS unit can be helpful for that as well. Okay, any other questions come in? Let me check the. I think that's it for today. So, thanks for joining us on today's call. Make sure that you go to our Holistic Health Hour site, and you'll see all our old calls. And hopefully, somebody asked a question that you are interested in. Also, go to our blog post. Our blog on our site. I don't know. We have well over 1,000 blog posts, and if you just do a search, we have a very nice search component, and you could find, a lot of things that you may be looking for. So you don't have to necessarily wait until next our next call. So go to Holistic Health Hour, and you'll find our all our other Holistic Health Hours. And go to connersclinic.com. That's CONNERS clinic.com. We'll go to our blog posts. Search our blogs. You'll find something interesting. A lot of our videos, I made a lot of videos. I know I talked about HCl deficiency. I made videos on that, and looking at functional lab values versus the medical lab values. I made videos on that as well. ConnersClinic.com. Go to our blog. Thanks so much. Bye-bye.